we are going to discuss NRTIs. It's a group of drugs called nucleoside reverse transcriptase inhibitors. First, we should know the examples for nucleoside reverse transcriptase inhibitors. That includes Zidovudine, Didanosine, Stavudine, Abacavir, Zidovudine, Lamivudine, Emtricitabine, and one more drug called Tenofovir. In this one important MCQ point, Tenofovir is actually a nucleotide reverse transcriptase inhibitor. Remaining drugs are nucleoside reverse transcriptase inhibitor. So now we are going to study the common mechanism action of all these drugs. Now we are going to study the mechanism action of NRTIs. Remember, once a virus enters into CD4 cell, the viral envelope is ruptured. Now look at this capsid. Once a capsid undergo rupture, it going to releases its content called RNA virus. Remember, doctor, HIV virus is a RNA virus. This virus having reverse transcriptase enzyme. Look at this. It's called reverse transcriptase enzyme. It moves along the RNA and converting the RNA virus into DNA virus. How? With the help of reverse transcriptation. Look here, the natural nucleoside getting attaches on the RNA virus and they become DNA. So the reverse transcriptase enzyme helping for the nucleoside to get attached and converting RNA into DNA, whereas our NRTI nucleoside reverse transcriptase inhibitor combinate with the nucleoside, naturally like a nucleoside, thereby preventing the attachment of nucleoside with the RNA, thereby not allowing the formation of DNA. That means, look here, the nucleoside is not able to bind, thereby not able to form the fully mature DNA virus. That means it abruptly causing chain termination. So remember, reverse transcriptase enzyme inhibitor inhibits formation of mature DNA virus. Now, because of inhibiting the formation of DNA, it is not able to going to bind on host DNA. So remember, doctor, the fundamental mechanism action of these drugs are competitively inhibiting reverse transcriptase enzyme, thereby natural nucleoside is not able to get attached on the RNA, thereby there is no formation of complete DNA virus. So inhibiting conversion of RNA into DNA. That's mechanism action of reverse transcriptase inhibitors. Now we are going to discuss some common points for nucleoside reverse transcriptase inhibitor. First common point, all are competitively inhibiting reverse transcriptase enzyme. Next, very important general information, all these drugs are need intracellular phosphorylation. So all these drugs in the cell undergo triphosphorylation, that is zidovudine first become zidovudine monophosphate, then zidovudine biphosphate, and then triphosphate. That means all these drugs needs triphosphorylation and then only inhibiting reverse transcriptase enzyme, whereas we have one drug called tenofovir is a nucleotide monophosphate. This drug needs only 2 more phosphorylation to inhibit reverse transcriptase enzyme. That means, doctor, remember, all these drugs needs phosphorylation to inhibit reverse transcriptase enzyme. And another important general information, all the NRTI prevent infections of susceptible cell, but they do not eradicate the virus from the cell that already harboring integrated proviral DNA. So already infected cell, that's all, gone. It's going to inhibit, they're going to prevent further CD4 cell damage. That's the beauty of NRTI. Then among the NRTI, remember the 3 points. We have Lamivudine, Emtricitabine, and Tenofovir. These are special drugs in the sense they are not only useful for treatment of HIV infection, they also useful for treatment of hepatitis B virus infection. This point is very important. What are all the anti-HIV drugs also useful for treatment of hepatitis B virus? Mean think of Lamivudine, Emtricitabine and Tenofovir. Another important general information, all the reverse transcriptase inhibitors not only inhibiting reverse transcriptase enzyme, they may inhibit human mitochondrial DNA polymerase gamma. By inhibiting mitochondrial DNA polymerase gamma, they may cause some general adverse effects like lipoatrophy, myopathy, lactic acidosis, neuropathy and pancreatitis. This problem is more with Zidovudine and Stavudine. Remember doctor, they in addition to inhibiting reverse transcriptase enzyme, they also inhibit human mitochondrial DNA polymerase gamma, resulting in some common problem. Another important information, all the NRTIs are generally undergo excretion through kidney, so there are needed dosage modification in kidney failure, exception Zidovudine and Abacavir. Remember doctor, the two NRTI which are safe in kidney failure patients includes Zidovudine and Abacavir. That's about general information. Hereafter, we are going to discuss individual drugs and their important informations. Stavudine. It is the first drug used for treatment of HIV infection. It is a thymidine analog. This drug also useful for preventing vertical transmission of infection from mother to baby and also used for post-exposure prophylaxis of HIV infection. Here, the most important adverse effect of Stavudine, myelosuppression in the form of macrocytic anemia and neutropenia. This is important MCQ. The dose-dependent adverse effect of Stavudine, myelosuppression in the form of macrocytic anemia and neutropenia. But you should know Stavudine also causes fatigue, malaise, myalgia, nausea, anorexia, headache and insomnia. Chronic therapy also causes nail hyperpigmentation and hepatotoxicity. And very important clinical point, Zidovudine may reduces intracellular phosphorylation of Stavudine. Thereby, Zidovudine and Stavudine should not be used concurrently. Remember, they are mutually antagonistic in action. So, these two drugs should not combine together. Next, very important question. Look here. First, look at the face. In this face, there is no fat. And here, excessive fat deposition looking like a lump. This is called lipodystrophy. Okay, it's one of the important adverse effects of Zidovudine. This problem is due to inhibition of human mitochondrial DNA polymerase gamma. I told already, NRTI, in addition to inhibiting viral reverse transcriptase enzyme, they may also inhibit mammalian, that is human mitochondrial DNA polymerase gamma, thereby causing lipodystrophy problem. It is seen with Zidovudine, and one more drug for NRTI causing this problem is Stavudine. But remember, Zidovudine, Stavudine both are causing lipodystrophy, in that Stavudine causing maximally lipodystrophy. But you should also know one very important another point. Among the NRTI, Emtricitabine, Lamivudine and Tenofovir, they have lower affinity for human DNA polymerase gamma, thereby these three drugs having less chance of causing adverse effect of lipodystrophy. One more very important MCQ on Zidovudine. Zidovudine, neither a substrate nor a inhibitor of cytochrome P450 enzyme, so no serious drug interaction. But remember, Zidovudine causing myelosuppression. So when you give Zidovudine with any other drug causing myelosuppression, severe problem going to occur. And one more point, Zidovudine causing problem of Stavudine activation. So Stavudine should not be taken together. All these are very important points. Stavudine is a thymidine analog. This drug causes so many adverse effects. For example, it causes peripheral neuropathy, lipoatrophy, lactic acidosis, and also causes pancreatitis and hepatosteatosis. Now, Stavudine is one of the worst drug causing so many adverse drug reaction. So today we are not very much recommending Stavudine. Remember, the most important adverse effect of Stavudine, dose dependent peripheral neuropathy, and the patient may complain of severe burning sensation in his foot and palm, peripheral neuropathy. So you must be very careful while using Stavudine along with any other drug which also causing neuropathy like ethambutol, isoniazid, phenytoin and vincristine. Remember, these drugs also causing adverse effect on neuropathy. So when you give Stavudine with this drug, there will be more chance of causing aggressive neuropathy. Sometimes Stavudine may cause progressive motor neuropathy that may be characterized by weakness and in some cases respiratory failure, all the symptom looking like a Guillain-Barré syndrome. So sometimes question, doctor, which is the antiretroviral drug may cause problem similar to Guillain-Barré syndrome in think of Stavudine. And Stavudine also causing lipoatrophy, lactic acidosis, pancreatitis and hepatic steatosis. All these are due to inhibition of human mitochondrial DNA polymerase gamma. Remember, among the NRTI, Zidovudine and Stavudine causing inhibition of mitochondrial DNA polymerase gamma. In that, Stavudine causing maximum inhibition of DNA polymerase gamma resulting in lipodystrophy, lactic acidosis, pancreatitis. So worst drug not commonly used nowadays. That is about Stavudine points. Didanosine. Actually, it's the acid labile drug. So given along with an antacid buffer that is called entry quarter form. This drug causing so many adverse effects like pancreatitis, peripheral sensory neuropathy, also causing optic and hepatotoxicity. Here reinforcing the point, the dose limiting adverse effect of didanosine is pancreatitis. Remember, this is important MCQ. The dose limiting adverse effect of didanosine is pancreatitis. And this drug also causing peripheral sensory neuropathy. So again, you must be very careful while using didanosine along with any other drug which also causing neuropathy like ethambutol, isoniazid, vincristine, cisplatin and pentamidine like that, because these drugs also causing peripheral neuropathy. And another important adverse effect, important point, didanosine causes hepatic damage. Because of causing so many adverse effects, these also not commonly recommended nowadays. So that's about important information about didanosine. Abacavir. It is the purine analog. The very important points are Abacavir in a HLA-B 5701 allele. In this genetic allele patient, Abacavir may have high risk of causing Stevens-Johnson syndrome. This point is very important, doctor. Abacavir in a HLE B5701 allele. In this genetic makeup, patient causes risk of severe hypersensitivity reaction in the form of Stevens-Johnson syndrome. That means for prescribing Abacavir, first thing you should do is do genetic screening and rule out this genetic makeup. Next point, Abacavir may also have a risk of causing myocardial infarction. This is also important point, but less likely to cause lipodystrophy. Here the two very important point in HLA B5701 allele patient, be careful, and this does also have a risk of causing myocardial infarction. Another important point, Abacavir undergo metabolism by alcohol dehydrogenase enzyme. So safe in renal failure. This point very important. We know all the NRTI except Zidovudine and Abacavir, all NRTI are unsafe in kidney failure. So remember, Abacavir safe in kidney failure because it is undergo metabolism by alcohol dehydrogenase, so safe in kidney failure. Of course, Abacavir also safe in pregnancy patient, but rule out HLA B5701 allele before using Abacavir. Another point, Abacavir neither a substrate nor an inhibitor of cytochrome P450 enzyme. That's also one important point. Lamivudine, it is a cytidine analog useful for HIV infection as well as useful for managing hepatitis B viral infection. The beauty of Lamivudine, it is the best tolerated NRTI, no serious adverse effect, rarely it may cause neutropenia, headache and nausea. It is also safe drug for treating HIV in pregnancy. And one more beauty of Lamivudine, it has very low affinity for human DNA polymerase gamma, thereby no risk of lipodystrophy or lactic acidosis. But the one very important point, Lamivudine useful for HIV and also having role in hepatitis B virus. That means what? If you are treating HIV patient with Lamivudine, suppose if the patient is having mild hepatitis B virus infection, a latent hepatitis B virus infection means abrupt discontinuation of Lamivudine may cause a rebound activation of hepatitis B virus replication and exacerbation of hepatitis. So remember doctor, Lamivudine on abrupt withdrawal in a patient who have mild hepatitis B virus mean they may get reactivated. This point you should have in your mind. So Lamivudine in general best tolerated NRTI. Emtricitabine. It is the cytidine analog useful for treatment of HIV-1 and 2 viral infection and also useful for treatment of hepatitis B virus infection. And a very important MCQ point, this drug also useful for pre-exposure prophylaxis in HIV along with Tenofovir. So remember doctor, 2 point I'm going to tell one more time. Look here. Emtricitabine in addition to HIV infection useful for treatment of hepatitis B viral infection. It's a very important. Next important question, Emtricitabine along with Tenofovir useful for pre-exposure prophylaxis in HIV patients. And one more point, it's a least toxic antiretroviral drug, safe in pregnancy. It causes only mild GI toxicity like nausea, vomiting, rarely causes hyperpigmentation of the palm. Another very important point, since it has a role in hepatitis B virus infection, abrupt withdrawal of emtricitabine while using in HIV patient may cause rebound activation of hepatitis B virus. So remember, similar to Lamivudine, Emtricitabine also on sudden withdrawal may cause reactivation of hepatitis B viral infection. That point you should keep in your mind. Tenofovir. It is the nucleotide reverse transcriptase inhibitor. Remember, all the other drugs are nucleoside, whereas the one and only nucleotide reverse transcriptase inhibitor name is Tenofovir. This drug useful for managing HIV 1 and 2 and also useful for treating hepatitis B virus infection, and is also useful for preventing viral infection as a pre-exposure prophylaxis along with emtricitabine, and this drug is safe in pregnancy. Here the very important MCQ point is tenofovir in addition to useful for HIV also useful for hepatitis B viral infection. This is again very important point. Because of that, when you are suddenly stopping tenofovir in HIV patient, if the patient having already a mild hepatitis B virus mean that may get reactivated. Remember the three important antiretroviral useful for hepatitis B virus infection mean think of Lamivudine, Emtricitabine and tenofovir. Second very interesting question is what are all the important antiretroviral used for pre-exposure prophylaxis mean think of tenofovir plus emtricitabine. Next point, tenofovir available in two formulation. One is called tenofovir disoproxil. It's called TDF. One more thing, tenofovir alafenamide. It is called TAF. So tenofovir disoproxil, tenofovir alafenamide. Now coming to the adverse effect, the most commonest adverse effect GI toxicity in the form of flatulence. Very important point actually. It causes abdominal distension and flatulence. That's the most common problem. But they also have a risk of causing acute renal failure, sometimes causing Fanconi syndrome, and then it will interfere the performance of vitamin D, thereby interfering the bone mineralization, causing osteomalacia and bone problem. Remember, the bone problem and kidney problem are less with TAF, that is tenofovir alafenamide. So all these are very important information regarding tenofovir. Non-nucleoside reverse transcriptase inhibitors, they are simply called as NNRTIs. First, we should know important, go through it. We have first generation NNRTI like Efavirenz, Nevirapine, Didanosine, and the second generation NNRTIs are Efavirenz, Rilpivirine, Doravirine. And we have one more newer drug, Dapivirine, that is given as per vaginal route. That's about drug name doctor. All these NNRTIs are mainly useful for HIV-1 and they do not useful for HIV-2. Now, coming to the information regarding NNRTI. First point, all these NNRTIs are directly inhibiting reverse transcriptase enzyme. They don't need intracellular phosphorylation. Remember, when we discussing NRTI, we discuss they need 3-phosphorylation to become active form, whereas NNRTIs are directly inhibiting reverse transcriptase enzyme. They don't require phosphorylation to become active form. And one more thing, all these drugs are non-competitively inhibiting reverse transcriptase enzyme. But the problem of these drugs are NRTIs are rapidly developing resistance. So these drugs should never given as a monotherapy. They are always given as a combination therapy, never as a monotherapy. But one interesting point, they have no cross resistance between NNRTI and NRTIs. There is no cross resistance between these two class of drugs. And then all the NNRTIs are mainly undergoes elimination by hepatic route. So be careful in hepatic disease patient. And then among the NNRTI, Nevirapine, Efavirenz, Etravirenz having microsomal enzyme induction property, whereas Didanosine having microsomal enzyme inhibitory activity. That means these class of drugs are more prone for drug interaction. And one more very important point, the common side effect of all NNRTIs are skin rashes, maybe mild form, sometimes severe form. Common problem, skin rashes. Now we are going to discuss individual drug and their special points. Nevirapine, one of the NNRTI, it is used as a single dose therapy, that is 200 milligram to the mother at the time of delivery and 2 mg per kg dose to the neonate within 3 days of delivery. This is very much useful to prevent vertical transmission of infection from mother to baby. That's a huge advantage of Nevirapine. Nevirapine having microsomal enzyme induction property, thereby causing so many drug interaction. But you should also note down Nevirapine having auto-induction property. That means it will induces its own metabolism. That means Nevirapine dose should be periodically increased because it undergoes auto-induction. Coming to the adverse effect, the common adverse effect of all NNRT is skin rashes. So Nevirapine also causes skin rashes. The rashes may be simple, sometimes serious form in the form of DRESS, dress. That means drug-induced rashes with eosinophilia and with a systemic symptom. That means a severe form of hypersensitivity reaction in the form of Stevens-Johnson syndrome or in the form of toxic epidermal necrolysis. That's important hypersensitivity reaction. And Nevirapine, in addition to skin rash problem, it also causes hepatotoxicity, hepatitis. That means whenever a patient on Nevirapine, advised to undergo periodically liver function test. So remember, Nevirapine causes problem of hypersensitive reaction in the form of skin rashes and also causing one more important problem, liver toxicity. Efavirenz, this drug will have more absorption when taken with the fatty meal. Coming to adverse effect, similar to all NNRTI, this drug also causes skin rash problem, but the unique adverse effect of efavirenz is neuropsychosis. This point is very important. The unique adverse effect psychosis characterized by insomnia, drowsiness, nightmare, and also headache, poor concentration, vivid dreams, and a lot of problem. So remember, in addition to skin rashes problem, the unique adverse effect of efavirenz is neuropsychosis. And efavirenz is teratogenic in animal model, but can be used in human being in pregnancy, that is after 8th week of pregnancy it can be used to prevent vertical infection of HIV from mother to baby. That is efavirenz. Rilpivirine, this drug should given only with food. It should not be given with high protein diets or should not be given along with the proton pump inhibitor. It is given mainly with the fatty food items for better absorption. Next point, as a common to all NNRTI, this drug also causing problem of skin rashes. That's a common adverse effect. This drug causes additionally depression problem, may also cause headache, insomnia, and increasing serum aminotransferase may cause hepatotoxicity problem and also have a risk of causing QT prolongation. Important. So three important adverse effects of rilpivirine are skin rashes, depression, QT prolongation, and also having risk of hepatotoxicity. Rilpivirine safe in pregnancy. Coming to Didanosine, this drug having microsomal enzyme inhibitory property, so prone for lot of drug interaction, and Didanosine is a teratogen unsafe in pregnancy. That finishes some special information regarding NNRTI group of drugs.